Good morning, everyone. Welcome, and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. For those of you in our audience who have attended one of our Zooms in the past, today's discussion may feel a bit different. On January 5th, Northern Light Health announced a new partnership with Optum. Today, we will learn more about this relationship, including what led Northern Light Health to this decision and the impact it will have on Northern Light Health employees, patients, and Maine communities. And while today's discussion will focus on healthcare, we are confident there will be experiences and challenges discussed that are shared across all industries, and we hope there is information and lessons learned that will assist you along the way. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Please join me in welcoming our panelists today. Mika Mioni, Senior Director of Market Performance Partnerships for Optum, Rob Zisman, Senior Vice President, Client Executive for Optum, Paul Bolin, Senior Vice President and Chief People Officer for Northern Light Health, April Giard, Senior Vice President and Chief Digital and Innovations Officer for Northern Light Health, Jennifer Fogel, Vice President Nursing Informatics Officer for Northern Light Health, and I'm also pleased to introduce Dr. Jim Jarvis, Senior Physician Executive at Northern Light Health and Director of Clinical Education at Northern Light Eastern Maine Medical Center. Dr. Jarvis will be providing an update on COVID-19, including information about the federal public health emergency and what it means for Maine when it comes to an end in May. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided today. As a reminder, this hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly informs our topics and helps guide our future conferences. Dr. Jarvis will get us started with the latest on COVID-19. So thank you so much, Dr. Jarvis, for coming back and joining us.
Thank you, Karen. So I'll just give a quick update about where we are, and we've seen these slides before. So the slide on the left is the community risk level, and you can see it's broken down by counties, and I really included just about, not just New England, but most of the Northeast in this slide. Remember that when they talk about community risk, this is really the risk to the community itself if we were to have a large number of people with COVID-19 who needed to be hospitalized. So you can see that the majority of our counties are in the green, which is great news for us, and some of them are still in the medium category. Most of this is really based on the number of people currently admitted in Maine for COVID-19 reasons, and that is much lower now than we've seen at most times during the pandemic. But that does not mean that there is not COVID-19 virus out there, because if we look at the slide on the graph on the right, that depicts where we are in terms of transmission levels. And you can see that not only is most of Maine, but most of the Northeast is still in the red for most of its counties, meaning that there is still significant amount of viral transmission throughout those particular areas. What the good news is that most people just aren't being hospitalized or dying from it when we talk about the Northeast. That's not necessarily true for other portions of the country where unfortunately the mortality rate is higher. And again, it speaks to the fact that we have a much more highly vaccinated population than most of the rest of the United States. Next slide, please. So I want to give a quick vaccine update because there has been some news of late. The first thing is that the new bivalent messenger RNA COVID-19 vaccines by Moderna and Pfizer have been shown to be effective in preventing severe disease, hospitalization, death, and in limiting infections from current circulating strains. So this is the one that we've been using since about September now for booster shots. Initially, we knew that they were good at preventing the severe disease, but only recent data shows that it actually also limits the spread from person to person. And that's important because that'll keep the amount of virus in our communities lower. Recently, the FDA Advisory Committee has recommended that the vaccine schedule be switched so that all messenger RNA vaccines are of this type. Currently, if you have not received any vaccination against COVID-19, the recommendation is to use the original mRNA vaccines and only use the bivalent vaccine for booster shots. The CDC Advisory Committee meets later this month, and it's expected to adopt those same recommendations so that the only messenger RNA vaccines that we use against COVID-19 are bivalent ones. They are also expected that they will lay out a preliminary vaccine booster schedule that more closely follows the seasonal influenza schedule, meaning that they won't recommend any other new booster shots right now, and will probably just start recommending them in the fall. Of course, all of this is subject to change if something changes dramatically in the viruses that are currently circulating. Next slide, please. So this is probably what's been getting the most play out there, which is that the federal government has announced that they plan on ending the public emergency declaration in May, specifically on May 11th, if all things go well. So what does this mean? This means that the federal government is recognizing that ongoing efforts to combat the spread and consequences of COVID-19 infections can be managed at the state and local levels. In fact, we really have been doing that for quite some time now with some federal assistance. It also means that federal supplemental funding will most likely cease for things like testing, vaccinations, and treatment for COVID-19. And that's important for our employers to understand because it may have consequences for your employees and the health plan that your employees fall under, because they may be subject now to copays that they weren't subject to before. Also, federal assistance programs to businesses and healthcare coverage expansion, like the expansion of Medicaid, will most likely cease or be greatly curtailed at this time. The details aren't finalized yet, and each federal agency has been asked to review their policies and processes for what they did as part of that public emergency. And then certain federal protections for insurance coverage will most likely cease or be rolled back in some way. And again, as I just said, that may mean that there will be that the copay suspensions that it put in place for testing and treatment for COVID-19 and in fact vaccinations may be removed, and therefore your employees may be seeing copays. What this does not mean is that the pandemic is over. And that federal, state, and local measures to protect workers and the general population immediately cease. So for healthcare, it does not mean that the OSHA regulations we currently fall under regarding masking and eye protection automatically end on May 11th. What it means is that those departments will probably do a more vigorous review of the data and determine whether or not changes needed to be made. But I think we'll see a lot of people who think everything is done at the end of this declaration. But that is not the case, as you could tell from my previous slide, where we still have significant amount of viral load in our communities, meaning people are still getting infected with COVID-19. And I think that's about my update. So Karen, I'll turn it back to you unless you have questions for me.
I do have a follow-up question, Dr. Jarvis, in regards to the booster. Is there any guidance yet regarding an annual booster? Is that on the horizon?
Yeah, so we think that's probably what we're going to hear when the CDC's independent advisory committee meets. So the FDA's advisory committee usually talks about safety and efficacy, whereas the CDC's advisory committee is usually the one that sets up that schedule that doctors and other health professionals use when we're giving routine vaccinations year after year. And so we expect that they will at least give a hint as to what they're going to do. Of course, everything is subject to change. And I looked at their website and they haven't even put an agenda on their website for their upcoming meeting yet, which means they're still in discussions.
Okay, great. Thank you so much, Dr. Jarvis, for the update. And certainly, Dr. Jarvis will be available to answer any questions at the end. If there's any questions around the topic of COVID, flu, the public health emergency, certainly put them in the question and answer feature, and we'll make sure that Dr. Jarvis addresses them later on today.
Thank you, Karen.
Yeah, thank you. So at this time, we will transition to the primary topic of today's Zoom conference. It is truly a pleasure to be able to welcome all of our panelists today. Throughout our time together this morning, we will hear from our panelists about strategies, considerations, and tactics used throughout the decision-making process that led to January's announcement. And we will also discuss what the current and future state of healthcare in Maine looks like as a result of Northern Light Health and Optum's relationship. To help get us started, Paul Bolin will look at relationships as a strategy to deliver Northern Light Health's promise to make healthcare work for you. So welcome, Paul. Thanks so much for joining us.
Thanks, Karen. So, a number of questions have come up over the last several weeks since our January 5th announcement. And, this is a very exciting opportunity for Northern Light, for our staff, and for the state, as well as for Optum. And so part of that opportunity, I think, really was born through a lot of significant due diligence. So our interactions with Optum started, way back last summer, where we were exploring the opportunity to partner with them in an arrangement such as we have. And it needs to work for both people, both the people at the table in discussions, both organizations. It needs to work for the state. And so all of that was part of really an extensive due diligence process that we went through together to make sure that this is the right opportunity for Optum, for Northern Light, and again, for our staff and patients. But ultimately, the decision to make an agreement like this is really born out of our need for an opportunity to do something different. We know nationally and certainly statewide, we've been impacted significantly with financial strains, and the healthcare industry was going through this, well before the pandemic. But the pandemic served to accelerate and exacerbate what was already, a problematic financial model in the healthcare setting. So healthcare has been operating on a very thin margin financially for years, and so that balance was offset by challenges inherent with the pandemic, such as significant illness of staff, people being out, for periods of time because of their own illness, an influx of COVID patients to take care of, in addition to patients with other care needs, as well as the need to bring in replacement staff to replace those who are out. So all of those factors really contributed to an unsustainable financial platform. But the middle of the pandemic is not the time to change your view or services to the community. That's when healthcare is called upon to fulfill its mission the most, and so that's what we did. But after the aftermath of that is, of course, now we need to reconcile what operating model is possible for us to have a sustainable platform going forward, and that's why we were delighted to work with Optum, and delighted to work on the agreement and ultimately come to terms that we found to be very beneficial ultimately for us, for Optum, and for the state. And so a number of the things that we focused on in this relationship are listed here in the slide, and I mentioned a number of them just now, but really this is going to allow us to accelerate a lot of the projects that we had hoped to do and had been working on prior to the pandemic, with some significant additional resources that Optum brings to the table. So we're certainly delighted by that. Next slide, please. So what's happening, as you've likely seen in the media, about 1,400 current Northern Light employees will transfer to Optum on March 26th. And so we announced that to our staff on January 5th. So there's a period in between that January 5th and March 26th date where we are working with staff to make sure that they have obvious questions answered, making sure that that there are operational changes that happen between now and then, and the employment model for Optum is certainly presented to the staff, that they get their questions answered. We spent a lot of time making sure that this was the right thing for staff. We tried to come up with an approach that was very unique and different from what we've seen elsewhere throughout the state and throughout the nation, with traditional outsourcing models where jobs are sent either to other states or outside of the U.S. This is a model where these are Maine people who are going to stay in Maine, working in Maine, serving Maine's communities. And so, it's a different model than we've seen. And so we're excited about that. We really think that this is going to provide some improved experience for our patients, certainly as well as staff. And one example of that, for example, is this first box in revenue cycle. Currently, we have different billing systems for our different hospitals throughout the state. It's a very costly approach, and bringing Optum in will allow our staff who are working in that environment right now to have one common platform. Optum has shown that they've been very successful nationally in terms of their revenue cycle process and software, and certainly we're happy to take some of the roadblocks that our staff have been faced with in the past that really at a pace that is much quicker than we would have otherwise been able to do it on our own. Information technology is another area. Our inpatient care management is really a great group of folks who are at the bedside and who are providing support to the care teams to make sure that patients are discharged as soon as they're ready, and that the beds then become available for other patients to take their place. And it's a very important role, and Optum has really done a very, very strong job nationally in their care management work. So we do expect that to be an added resource for our staff. Supply chain is another example where we have significant economies of scale. Northern Light, by Maine standards, is a large employer, but by national standards, it doesn't have the buying power that an organization the size of Optum would. And so contracting is a good example for supplies, where we'll see some immediate benefit in price reductions to help keep our costs lower, and we can continue to pass that along rather to our patients throughout, and employers throughout the state who are ultimately paying for healthcare in Maine. Analytics is another great example with the depth and breadth of the analytics that Optum provides. We've got great staff on our analytics team, and they're very generally very eager to have the extra resources and colleagues throughout the world, really, on the analytics side to help them accelerate their work. And similar with our program management and performance improvement operations. Next slide, please. And so some examples just on the digital side, and this just lists out using digital, the digital experience as one example for purposes of today's discussion, but really accelerating our digital strategy, providing additional staff and resources for investments. And as our CEO, Tim Dentry, has mentioned, those are resources and investments that Northern Light won't have to make because Optum will be helping us in that effort. And that will allow us to take our capital dollars for other opportunities in the state that more directly impact our patient care. And we see some of that investment going on in Greenville and in Bangor at Acadia Hospital and Blue Hill, where we have projects going on now to expand and modernize facilities in those communities. Again, leveraging industry partnerships. We've been doing very well on our own, but this is an exponentially much larger connection to leverage additional relationships throughout the country that we wouldn't have been able to have access to. So some great examples of how we're able to improve the experience for our patients and for our staff. Next slide, please. One of the things that really was a key focus for us, and as I mentioned, we did a lot of due diligence to make sure that this worked well for our staff. And that was really one of the key driving points. We wanted to make sure that staff were not going to be laid off as a piece of this this work, that people would be made whole with regard to their base pay. Optum has a very robust total compensation and benefits package. And so we knew from a benefits perspective, there's obviously going to be things that are different, but overall it's a very competitive opportunity for our staff. And so that was one of the key points, but also what kind of culture does Optum offer, and how well are we aligned as an organization? Back several months ago, we spent time with Optum leaders and Northern Light leaders working through some of those questions. And ultimately, as a group, we felt we are very well aligned, and that was our ultimate conclusion. This vision statement here that I'll read, this was a joint statement that was drafted by that group of leaders from Optum and Northern Light. We're a fully unified team, fueled by our commitment to the future of securing a solid foundation to deliver an innovative, high quality, consistent patient experience for Maine people. When we look at our organization's values and mission, you can see the Northern Light and Optum's mission are very similarly aligned. And even reading our core values, integrity, respect, compassion, and accountability for Northern Light, and Optum, very similarly, integrity, compassion, relationships, innovation, and performance. It seems clear that both in paper and in practice, the organizations are very well aligned in culture and values. And so that's why we felt that Optum was the best partner for Northern Light. And we're certainly very pleased with our colleagues here, some of whom are here today, and I'm happy to share some of their have them share some of their own comments here in a few moments.
Thank you so much, Paul. Really appreciate you. Your honesty, transparency. I think that's important as we venture into these conversations today and our ongoing conversations as a system as this work continues over the next years of partnership. It's really exciting. And as Paul noted, shared and complementing values are really essential components for an effective relationship. I am sure there are many within our audience and in our communities who may not know what kind of company Optum is and therefore may not understand how this will help meet the needs of Northern Light Health patients. So at this time, it really is a pleasure to welcome Mika, who's going to tell us a little bit more about Optum.
All right. Hi, everyone. My name is Mika Mione, and in my role, I really do focus on that culture and mission alignment. And that helps us determine not just the business case, but how are we going to work together moving forward? Do we have a shared vision for success? Do we have agreed upon operating norms and guiding principles to ensure that success? It's one thing to have a strong business case to partner, but you really have to look each other in the eye every day. It's truly a relationship, like any relationship. When you come together with an individual or a group, you want to make sure you can work well together. So that's where I put my energy and focus. As you can see here, Optum is part of United Health Group. We are a health services innovation company. Our mission is to help people live healthier lives and helping make the health system work better for everyone. You'll hear that in a variety of ways today. We are lucky to be a Fortune 5 company, and that's due to the joint success of both United Healthcare and Optum. United Healthcare, many people are familiar with as an insurance benefit organization, a payer organization. And then Optum, people are less familiar with, but we are equally to be recognized for the success of overall United Health Group. And Optum's really focused on that technology that's needed to enable successful healthcare delivery. And so when you think about a partnership like this and what Paul just shared with revenue cycle and IT and care transformation, analytics, etc. So we support all those functions within a health system to create the efficiency, evidence-based practice, benchmarking, etc. And then we also have developed lots of technology as well as those top of license practices to help infuse some modern approaches, some AI approaches, those digital approaches, and that help people do their jobs better and more efficiently, but also help the patient and the community have a better experience when they engage with the health system. So that's a little bit about Optum.
Thank you so much, Mika. And we will dive into more, and I'm excited to learn more from you and Rob today. So thank you both for joining us. And at this time, I would like to invite all of our panelists to turn on their cameras as we transition to the roundtable portion of the conference. Again, I'd like to invite members of our audience to submit questions using the question and answer feature at any time. And we will do our best to address them throughout the time together this morning. So thank you all for joining this panel today. Before we dive into the questions, I did want to invite you all to share briefly what your role is in the transition. I think this may help our audience understand the perspective you bring to the conversation today. We know your titles, but what are your primary responsibilities right now as it relates to this partnership? And so why don't we get started with you, Mika?
Great. Yeah, absolutely. So I've been lucky in that I've been part of this journey since day one. So as Paul mentioned, we started thinking about what does a partnership look like back in May, June timeframe. And now that we're in this transition, meaning that term is really specific to the employees. And so the employees have been notified of the partnership, and those 1,400 employees know that they will become part of Optum. And so we really focus all of our attention on them. What does that mean to them? What resources do they need to feel supported for that transition into a new organization to be successful? A big part of that too, and Rob will probably touch more on this, is how do we make sure there's business continuity? We don't want any interruption to performance. So my role specifically is to work with Paul and our HR leaders within Optum from a change management, from an engagement, from an employee experience perspective, to make sure that we're really nurturing and taking care of the people along the way.
Thank you so much, Mika. And many would argue that's one of the most important, if not the most important role. So appreciate that. Rob, how about you?
Sure, absolutely, Karen. And again, thank you for having us this morning. So I'll be a part of the overall leadership team working with April, who we'll hear from shortly, in regards to the leadership of the 1,400 employees coming over between Optum and Northern Light Health, but also how do we leverage the Optum resources and tools through the broader organization and really bring those to bear as a counterpart to really help as we work to move and improve the administration and the operational functions we'll talk about a little bit more.
Great. Thank you so much, Rob. Paul, how about you?
So I was looking at the chat here. Could you just trying to respond to Aaron Hubler's question? So my role, that's the question, my role?
Yes,
Yeah.
in the transition.
Sure. So as Chief People Officer for Northern Light, my role is to ensure that our staff are treated well. And part of that includes not only the decision that we made and communicated in January, but also the transition. So to make sure that that the staff, the 1,400 who are transferring rather to Optum, will certainly have a smooth experience, but also the 11,000 folks that we have at Northern Light who are not transferring to Optum, making sure that they understand what's happening with their colleagues, that they're being treated very well, that we're very optimistic that this is a move that helps to reinforce the long-term sustainability of Northern Light Health, which is good for the staff, for the state, et cetera. So all of those things are part of that work. And it's a really a team effort. And so there are many people working both on the Optum and Northern Light side to ensure that our staff are treated very well, both the staff transferring and those who are staying with Northern Light.
Great, thanks, Paul. And we'll make sure that Aaron's questions first on the docket for you to answer.
Sure.
April, how about you?
Good morning, everyone. And as Karen mentioned earlier, I'm Senior Vice President, Chief Digital and Innovation Officer here at Northern Light Health. And certainly I will continue that, but a new role, an important role in the transition and ongoing is the Northern Light Health and Optum's relationship executive. And what that means is I'm really the executive responsible for making sure the relationship is resulting in what we had set out and have goals to do. It's really nurturing the relationship and making sure, again, this is a long-term relationship, so we work together. And then, of course, all of the staff that are going and becoming Optum employees are very high priority for me in making sure that they are integrated and still a part of Northern Light Health, as well as their new family in Optum.
Thank you, April. And Jen?
Last but not least.
Certainly not.
Thank you. And as you mentioned before, I am the Chief Nursing Informatics Officer, one of them. And so it's obvious from that title that I am one of the leaders, but I am also an employee who is transitioning to Optum. So like all of the rest of the 1,400, I am going through that process of changing what I'm going to be doing, who I'm going to be, who's going to control my benefits, and all of those types of things that all of the employees are currently going through. So I'm helping our staff work through that as I work through it myself.
I appreciate that, Jen. Thank you so much for joining us. And so, Paul, I know you were in the process of answering Aaron's question. So why don't we just dive right into that? How does switching employees or transferring employees to Optum in this relationship potentially help us address the staffing challenges that we've been facing?
So I think that transferring employees from one employer to the next in and of itself doesn't address the staffing challenges. But I think what we have created, I think, in this partnership is really an engaging and compelling reason why Northern Light Health is different, and why we really take into account the impact to our staff very seriously as one of our top priorities. And so I think that it shows that we're committed to our staff. And I think all of that goes along with improving our retention and our ability to recruit. But also, as I mentioned, earlier in some of my comments, taking some of the roadblocks, the frustrations with, different billing systems, for example. Just the largest group of the 1,400 comes from our revenue cycle area, our billing group, and dealing with the frustrations of 10 separate billing systems poses challenges to our staff that they won't have to face going forward. So I think in that regard, it certainly will help remove some of the frustration and barriers for our staff. So in that regard, I think that's a direct and immediate improvement. But overall, the work that Optum and Northern Light are doing together doesn't make our workforce challenges within the state go away. It just makes a more robust platform to have a different career and increased opportunities with us.
Thank you so much for that. Go ahead, Mika.
Yeah, if I could add to Paul's comment, within Optum, we do have about 220,000 employees. And so as you think about the 14 joining, their peer group is growing exponentially. And so they're able to meet people, problem solve with people, thought partner with people who do what they do, who have been solving the same problems that they've been solving. So to Paul's point, it's not an immediate fix, but it does provide some relief, and they can tap into those peers to help them. So I think a lot of folks are really looking forward to that.
Thank you. Thank you so much, both of you. Paul, I wanted to follow up a little bit, and certainly I would invite Mika and Rob to chime in on this as well. You had referenced the 1,400 employees. I know that was a very, that's a decision that weighed heavy on Northern Light Health leadership as we were deciding what the best decision would be for us strategically as a system to move forward and better serve our communities. But in addition to that 1,400, you mentioned the 11,000 that are remaining as Northern Light Health employees, and then the families that are impacted by this decision, which is in the thousands. We have families who have an employee who is transitioning to Optum who are still employed at Northern Light Health. And it's created quite a conversation at the dinner table, as you can imagine. So I'd love to hear more about, the considerations that Northern Light Health had when they made that decision, and how that weighed on the leadership, and what was most important to you when you were selecting the partner.
Sure. And so, and making sure that that we are not displacing staff, that we have, if we're going to have any sort of partnership where employment is transferred from one employer to the next, it needs to be the right employer. Optum really has, like I said, a very robust and detailed, and in many ways better than what Northern Light offers in many instances. So there are certainly trade-offs with any benefit package, et cetera. But it's a very, very competitive and very compelling, employment opportunity for these staff. But really, the focus, that we put in this decision was we needed to do something different. And what is that? How can we help to curtail our cost inflation that we continue to see? How can we provide better service to our patients, to the state? All of those things weigh heavily on all of us as leaders in healthcare, and we're really confident that this is an opportunity to do things differently. There were 5 other agreements when we partnered with Optum in this agreement. They had done this 5 times before. So we actually reached out to talk to some of those prior relationship, those organizations throughout the country that have had these relationships with Optum longer than us, to see what their experience had been. All of that was very carefully done to make sure that not only the impact to our staff, but the organization is the right opportunity for us. And we're very confident that it is. I think Northern Light has demonstrated throughout the pandemic, we really have leaned in hard to make sure we're doing what we're able to do to support our staff and come up with new and creative ways to do that. And this is another one of those opportunities to continue to bolster ourselves as a financially sustainable organization. And financial sustainability is not a guarantee, certainly in healthcare. And our economic realities need to be faced, need to be addressed. And I think this is a very innovative and an excellent way to do that.
Thank you. Thanks, Paul. And let's talk a little bit about that employee experience through this transition. And Jen, I'm going to go to you next. So be prepared here. 43 amazing years at Northern Light Health. So you must have started, in elementary school, of course. And love to hear, you didn't know about this transition until January 5th when it was announced and shared with you as a leader, and then your team as their direct report. So I'm just curious to hear from you what your experience has been, the journey has been in terms of emotion for you personally, but also for your staff, and what feedback you're receiving from teams that are part of this transition.
Yep, I think probably April would tell you that she was worried about how I would react given my years of service at Northern Light, but I'm excited. I think that this is an amazing opportunity for everyone who's transitioning, and we are going to lead the way in healthcare. And the resources that Optum is going to bring, I wish I was 20 years younger and not looking at the retirement, because I think that we really are those young folks who are coming over are going to have endless opportunities with this company. And we are going to transform the way that Northern Light works and become a true leader in, we're seen as a leader in our electronic health record space. And we are just going to continue to lead the way and transition. I'm excited. And I will say, and from, there's a lot of trepidation from many people, because, there's changes with their, what's my pay going to look like? What's my PTO going to look like? What is my benefits going to look like? But the transition that's been happening, the number of meetings that are available, and they're more than once. So if you didn't quite get all your answers at that one meeting, you can go to the next one so that you get your answers. The transparency and the willingness to help folks through this process is it's commendable. And I'm very proud to be part of Northern Light Health and soon to be Optum and experience something that has gone this well. It truly is an amazing effort. And I think one other thing is, you have to think about the decision that Northern Light made. They did not want to have to get rid of employees. And so taking this risk and this journey to maintain folks' employment is truly a commendable step. So I really am very appreciative of that.
Absolutely. I am too. I'm not part of the transition, but I have family who are. And it's been just a journey for all of us, but one that I'm incredibly grateful for Northern Light Health leadership and the Optum leadership for really doing their due diligence to make sure that everybody understands the why behind this decision and can get excited about what's to come. I really, truly do mean that. So thanks so much, Jen, for sharing that. I couldn't agree more from the other side of the coin, I would say. And April, you're part of the transition as well, and you've known about it a little bit longer. What has been the journey for you, and what has been the experience as a leader to help make this happen?
Well, personally, I've been part of the due diligence research meetings and really diving in to understand what this means, what it means for Northern Light Health, what it means for the community, what it means for employees. And, you know, in the beginning, in my role, again, I have now the relationship executive, and it was originally thought the relationship executive as a Northern Light Health employee. And it was my recommendation to be the relationship executive for Northern Light Health and Optum over that, but as an Optum employee. And the reason why, you know, I suggested that was comes down to really a core thing, which is our staff, our people, and believing in my commitment. This is after all the due diligence, the right thing for Northern Light Health to do. And so we can continue our mission in this community, and to the staff that work so hard to make that happen. And as I think first in Optum's previous engagements, to have a senior physician, a senior vice president go over to become an Optum employee during this engagement was new and different. And but you know, leadership is about making the right decision for the greater good, and understanding how a leader can help with the transition and the work ahead of us. And I think it became a very easy decision for me because it was the right decision, and I'm committed. You know, I think actions speak louder than words. And I think my action by doing this and helping to lead this with all those employees and executing on the partnership and the deliverables that we want to happen is that part was a very easy decision. And so I am not unlike others. I have my own list that I've got to understand implications and anxieties, but frankly, it's really minimal. I'm truly blessed to be able to do this for Northern Light Health.
Thank you so much, April. I really appreciate that. I'm going to ask Rob the next question, and I'll give you a little intro, Rob, to get your head around what I'm about to ask here. And it's really about just Maine communities. And one of Northern Light Health's most successful campaigns was Maine Made Us. And there is great pride and appreciation for services delivered to the people of Maine by people who share our value of community and share our culture of caring. And as a large employer with a global presence, Mika said you have over 200,000 employees. When engaging with a healthcare system and a new relationship like this, what strategies does Optum deploy so that you can still offer that local and, you know, focus of community focus?
Yeah, great question, Karen. So I'll answer that in a couple ways. First and foremost, it's really important to know that the 1,400 employees who are transferring from Northern Light Health to Optum will continue to fully focus on Northern Light Health and the people of Maine. I think that's the first part. Secondly, in terms of the community, you'll continue to have the ability to access care at Northern Light Health, just as you always have, right? That won't change. The care that you receive in terms of the hands-on care delivery, that will continue to be delivered by Northern Light Health as well. And so really our role at Optum through this relationship is to focus on improving the administrative functions and the operational functions, such as the ones we heard earlier related to revenue cycle, information security, information systems, project management, care management, and so forth. And by doing that, that will also free up and allow Northern Light to continue to focus on its mission on delivering care and really focusing on that care delivery to the people of Maine.
Great. Love that answer.
Karen.
Go ahead.
So, you know, I would like to, you know, just to kind of springboard off from what Rob was saying, and also looking at some of the questions. And so not only are they going to be continuing to do their job all of us and focus on Northern Light Health the same way they are doing it today. But we're also not changing over our electronic health system. That's staying with Cerner. We're not changing big things for, you know, our patients will not have to look at a different and go through a different portal. That portal is still the same and how they do things today. And those were some of the questions, you know, your telehealth experience again, and I can get to it a little bit more as we move through today, this session, but all of that is staying. It's just going to be building on what we've already done and improving it and expanding it and accelerating it. So it will be those things that happen behind the scenes to help us continue to do what we've already done and want to continue to improve or accelerate or expand. So no changes like that. At all. So there's nothing that will happen magically on the 26th. It will probably be, people wonder, so where's the, you know, what happened? And the fact is everybody's still doing their same job. And even after the 26th, we're just going to continue to utilize everything like we are today. So I think there was some of those in the chat, and I wanted to make sure that I thought it was appropriate after what Rob said.
Absolutely. Thanks, April. And Mika, did you have something that you wanted to add? I know that you did come off mute there for a moment.
Yeah, thanks, Karen. So when I think about community, I also think about the broader community, and I'd love to just spotlight a little bit how we think about taking care of our local communities. And now that we have this deep and rich partnership in Maine, you know, where we'll have employees living and working from a philanthropy or social responsibility and corporate giving point of view, we really focus in on those communities where our employees live and work and where our important partnerships are. And so one of the many things that we'll do as part of this partnership is look to invest to support local community efforts. So for example, Northern Light does a community health needs assessment. And in that community health needs assessment, they identify, you know, fancy term, but social determinants of health. And essentially what that means is, you know, what are the barriers for healthy living, whether that be behavioral health, whether that be access to care, transportation, et cetera. And those are things that we care very deeply about as well. So we'll work together to support nonprofits, to support those behavioral health efforts, et cetera. So that's just, I would say, maybe an added benefit in that we're pretty passionate about our ability to support local communities from that social responsibility point of view.
Wonderful. Thank you, Mika, for that added insight. That's exciting. I wanted to toss the next question. I'll start with you, April, but it might there might be others who want to chime in. In the Bangor Daily News, there was a headline that said $1 billion savings as a result of this relationship with Optum. There's some real confusion and questions about that. So I'm wondering if you can give some insight into what does that actually mean? Is it $1 billion in savings, or is that a value question?
Yeah, it's actually that 1 billion is about the future value, and so it's not about the 1 billion like as a savings. And sometimes, you know, that people might use that interchangeably, but there is a difference. The 1 billion, it's about the value of our future, and what does that mean? Is the value is how we're going to transform some of the work that we do today in process improvements. So just like in businesses that that some of our participants are in, it's how are we going to do things differently, innovatively, streamlined and more efficient so we can get value in our future. And I think that's exactly what we're going to do. And Optum has worked with a lot of other organizations on many things that we are planning to do that have driven value, and they've seen value out of it. And I think that's the important thing is, so it's more about our future and what we're going to be able to do and leverage expertise that Optum brings to the table and resources to help us do that.
Thank you,
So-
April. And Rob, I saw that you went off mute. Did you have anything you wanted to add?
Yeah, I think that's great. And just a couple practical examples. So earlier, Paul mentioned supply chain, right? So Northern Light has a specific purchasing power today. Now through the relationship with Optum, where there's areas to help get greater purchasing power. I think that's a very specific example in supply chain. Building on some of April's comments, we know in healthcare, like many other industries, there may be manual processes that we do today. So to the extent there's an opportunity to leverage technology and modernize and automate some of those processes that folks may interact with on a daily basis, whether it's retail, right, or banking, how do we bring that to life in healthcare? And then the third part is really around some of the process improvement for how do we leverage the existing assets and facilities within Northern Light to the extent possible. So those are three specific examples I'd share as well.
Wonderful, thanks. And kind of as a follow-up to that, and also something that April had said earlier, we know that at least initially things are going to feel and look the same. There's no plans for, changes to how services are delivered via telehealth, for instance, where our electronic medical record is remaining the same. But ultimately, it seems as that we do want to see some changes to that patient and user experience with Northern Light Health. So I'm wondering, this is kind of a, a toss up. Who wants to take it? April, you're off mute first, so you get it.
Yeah. So Northern Light Health has a very aggressive and comprehensive digital strategy. So let's, from an end user, and we have been, some of you may know if you've been, we hope so, is whether that is online appointment scheduling, telehealth services, and I could go through a number of those things that we have already implemented. We have a very large list of things that we want to continue to do, which directly improves the consumer and the patient experience. But that takes funding. And when Northern Light Health is in the situation like many are in the country, that you've got a only finite number of resources, meaning of dollars to spend, we would be faced with slowing that down, maybe not doing as many as fast. And that's not what we want to do, because we actually do want to continue to bring those forward. And so what this opportunity allows is for us to be able to continue that strategy, bring those tools to our consumers that we wanted to bring, and then even some we didn't think of because Optum is bringing to the table. So that's what we're allowed, that's what we'll see. And when it comes to the electronic health record in particular, Paul mentioned a number of times our revenue cycle systems. We've got numerous. It's to maintain all of those are expensive, they're inefficient, and frankly, probably our patients notice when things aren't correct, or there's some duplications and just some frustration in that because it's different. We have always wanted to and had a plan to get us on one. But again, that took a lot of effort, dollars, and support to be able to do that. So Optum's very excited to help partner with us to get that in place and start that up very soon on our journey to one platform for our billing and revenue cycle.
Exciting times ahead, I think. And this isn't the first partnership that Optum's had with a health system. Mika, I know that there's several others. As you partner with Northern Light Health, and as this moves forward, are there areas that you've learned you need to approach more cautiously in order to make sure that we get to what success looks like? Things that you're more mindful of?
I think we've gained a lot of experience. We now have 7 similar types of partnerships. And what makes these partnerships unique, so when we say 7, people might wonder, like, what does that really mean? What makes these partnerships unique is that we bring forward multiple assets or capabilities within Optum. So there's a lot of organizations out there who just do revenue cycle management, or just do IT outsourcing and management, or just do healthcare analytics. So what makes this very unique is the health system gets the benefit of working with one person, or one organization, I should say, and so it creates synergies across all of those areas. So that's really what makes it special, I would say. So now we have 7 of these types of partnerships, and every time we go into a partnership, we learn a little bit more. And there's so many unique qualities too. You've used the term Mainers, and here in Maine, I think something that's very unique about Maine is that commitment to your identity as a Mainer. And there's the others or the outsiders kind of, but it's also a very warm and welcoming community at the same time. And so I think what we've always believed in, but it has continued to be validated, is where we started with Paul talking about culture and value alignment. We really needed to understand what makes Northern Light Health special, what makes Maine special, and it's our job to flex to that. And at the same time, I'm sure April and Paul and Jen would say, we're also looking at Optum to push us, to challenge us to be, even better, faster, more efficient, et cetera. So really being intentional and mindful and taking the time to discuss these things, to, as we're designing our governance and how we're going to solve problems together. So I would say that's been part of the learning, is that it's not an out of the box process. It's a very custom process.
Rob, did you have something you'd like to add?
Yeah, so I would just add, I definitely share the excitement and passion that I think folks heard from Jen earlier today, as well as, right, how April mentioned the digital strategy. And so I think one of those lessons learned is we're going to have a team that is super excited. And when Jen says she wants to climb that mountain, everyone's ready to run. Though March 27th, right, not a lot's going to change, right? Because our key focus early on is really business continuity and developing that thoughtful roadmap of how are we going to work together to really transform healthcare to make it better for everyone in a very thoughtful way over time. So really the pacing of that work and the change, and balancing that with, the excitement to climb that mountain.
Love that. And I have no doubt that Jen could get any one of us to climb that mountain. Her energy is just contagious. So Jen, I'm going to offer you the last question, because I'm really curious, given the role that you bring and the perspective you bring to this conversation. What does short-term success look like to you, and what does long-term success look like from your perspective?
Oh,
I know I didn't give you any
That's
time.
a really good one. No, I think short-term success, when you look at this, is really getting us to March 26th, getting the staff all on board, and getting rid of that remaining unknown out there. People just want to get to March 26th. We want to get through all of those parts and pieces to get us there. And then I think the long-term success is really the creation of that roadmap and how we start to transition and become better and really start to evolve as a partnership and reach the goals that we all want to reach. So to me, that's kind of where it is. And then, of course, my longest term goal is, let me push that retirement out a little bit further, because I want to experience this opportunity and see what we can't get. So that's the longer roadmap.
Well, I would never be one to encourage somebody to push off retirement, but happy to hear that you're that excited about it, Jen. And I think this has been such an fascinating hour, rich discussion. I thank you all for your contributions today. I think we could continue to talk for another hour. There's just so much to discuss. And as things evolve, we'll look for opportunities to continue to share this information with those of you in their communities. And so please continue to stay tuned as we keep you up to date with all that is happening, because it is going to be a fun journey to experience together with our main communities. So with that said, I want to encourage you all to stay tuned for details about what our next Zoom conference will be. By attending today, you will be among the first to know. And I also want to encourage you to please complete that 5-question survey that will be arriving in your inbox shortly. That will help inform next session as well. And finally, as early as tomorrow, a recording of today's session will be on Northern Light Health's website. So please know that that's available for you, as well as all past recordings and resources that have been part of past conferences that we've offered the community. So in closing, by working together to promote good health, we will be promoting good business. Thank you all and have a wonderful afternoon. Thank you so much, panelists.
Thank you.